Working primarily in geriatric psychiatry, I see a lot of patients in the hospital, so they're often kind of at their worst, but we do our best to kind of restore as much quality of life as we can. So what I love about Sage Oak is that when I'm in the facility, I don't even think of it as a facility. It's like I'm in a house, and so it's really comfortable for the patients. You can tell that they really enjoy being here. The staff are incredible. The setup is unlike anything I've ever seen anywhere else. I mean, the model here is really unique and very different, but in a very good way. So I think it really does best approximate a home environment, and it minimizes what can often be a very jarring experience for families and patients, residents who may be coming from their home and trying to make a transition to a higher level of care, but it doesn't feel like that for them here. They transition very, very well. You know, a big thing in my line of work is to help maintain patients where they're at and to avoid a step down if it's not really time for that. Having, you know, kind of different tiered settings for, you know, more advanced and progressive illness is beneficial because it helps those individuals where they're at stay and be around others who can kind of engage with them at their level. And it also helps staff engage with them appropriately too. Curated and tailored are very apt descriptors for it. It helps me, for example, to recognize when someone's having problems because it's more readily apparent to those around them that, hey, this was okay and now this is not, and we're seeing this and we want to address that. And families have a better sense too of what to expect and what they can expect when that's going on. And there's much less concern that someone's going to be ignored or not going to be noticed. It's a huge decision, and it can be a huge burden for families facing this. I can say Sage Oak has taken huge steps towards improving that and lessening that burden on families and the residents. When I'm here, I see people in their element, a lot of activity. It's very open. There's a lot of engagement, and that's a huge weight lifted for a lot of families who may feel like making this step is a step in the wrong direction. I think at Sage Oak, they work very hard to make sure that families feel comfortable making that step. But when families are asking me that question, the first thing I'm always kind of assessing is safety. You know, are residents safe at home or safe at their level of care? And it could be anywhere, right? You know, you can have safety issues really in any setting. I think Sage Oak does a wonderful job addressing those safety concerns just by being itself. Again, the facility is very open, there's a lot of engagement. The staff are very attentive to needs and identify things very quickly. And prevention is the biggest way to address safety. So it's very safe here, and they work very hard to maintain that without even seeming so. Probably the biggest thing is families will ask me, you know, what can we do about this problem or this problem? And it often is regards to anxiety, mood disturbances, where their memory impairment may be affecting quality of life. The most common thing I'm asked is how can we make some changes, you know, here to address that? Again, with Sage Oak, a lot of those kind of things get taken care of just in the daily routine that they engage with patients and residents here. Well, oftentimes, you know, families are looking for specific problem-focused solutions, which is okay to a point, but often a lot of them could be addressed and even prevented when you have a setting like this.